Hi, everyone. Welcome to the show. I'm Dr. Nicole, and on today's episode, we're talking about the power of plants to support brain function, behavior, and more. We all know that plants like fruits and vegetables are important for brain and body health, but today we're going to talk specifically about how the bioactive compounds in plants, also called phytonutrients, which you've probably heard me mention before, impact our health and how they can even be used therapeutically to improve specific symptoms. To help us understand how all this works and some starting points to consider, I've invited Dr. Dan Gubler on the show today. Let me tell you a bit about him. He's a natural product chemist that has traveled to every continent, discovering and researching bioactive compounds in plants and using them to help others. He has 16 patents and has developed 70 nutritional supplements. He's an expert on how phytonutrients can improve health conditions. He's a member of the London Speaker Bureau, has spoken at over 150 events in 40 countries, and is co-founder and chief scientific officer at Brilliant, an innovative, proactive wellness company that creates nutritional supplements to help people unleash their innate brilliance. He's also the host of Discover with Dr. Dan, the Proactive Health podcast. Dr. Dan, thank you so much for being here. Welcome.
Dr. Nicole, it's sure a delight to be with you. I'm so excited.
So I'm thrilled to have you on to talk about this topic because I think this is such an underappreciated, under-recognized, component of health and wellness and of addressing symptoms. So this is going to be such a great conversation. I would love to start by really having you share a little bit about your story. I don't know your background of this, so I'd love to hear how you got interested in focusing on plants and health.
Yeah, so I'm a natural products chemist by training. And so, like I said, I travel around the world studying compounds and plants. It really started from a young age. I grew up in Utah in the Mountain West, and I loved hiking. I loved collecting plants. I collected fungi, mushrooms, and whatnot. And I started reading traditional medicine books about Navajo traditional medicine and Anasazi and in the Four Corners area where I spent a lot of time when I was younger, talking with different traditional medicine healers and learning, that there are different things that you can do when you have a cut. There are things other than Neosporin and a Band-Aid, which is kind of common thing, So it was just fascinating to learn that certain plants and different resins from plants can do different things. And when you steeped plants in different, in liquids, you could pull out the bioactive compounds. And so it kind of went from there. I remember from a young age, I loved mixing potions. I would beg my mom during those, during the summertime, that's just horror for a mom when the kids are at home and there's nothing to do. And they're like, and the mom and the parents are like, oh my goodness. I would beg my mother if I could go into her kitchen and start mixing different spices with water and things. And I would mess with steeping times and whatnot and drink the potions or, have it be the undesirable reward for someone who got caught in our game.
So chemistry was in your future for sure.
It was. My grandfather was a biochemist, and so I grew up with just palling around in his lab, and it went from there that I started wanting to understand more the organic chemistry, the structure of the bioactive compounds, like what compounds were actually in the plant and some of their bioactivities. And so it went from there that I did my undergraduate and then went to graduate school and postdoctoral research. I was a professor, too much school, way too much school, but it really, yeah, you know that path, but it really, set me on a path to do what I love, which is finding compounds from plants and using them to help others.
It's really great. And I think, I don't know if this is true, just in my experience, like I know a lot of people who are chemists, but there's not a lot of natural product chemists. Like most people who go into, chemistry, bioengineering, those kinds of things, they're not looking at the stuff that you specialize in.
No, not at all. Most of the time, chemistry is all about titrations or, people working in the petroleum industry or even in pharma. In pharma, they do work with organic compounds and whatnot, but they aren't really looking in depth at compounds in plants, especially in foods, and how they interact with the body.
Yeah. Well, let's go there next, because I want to lay a foundation for people. Some of, our listeners are probably tracking with this and going, oh, this is awesome. I can't wait to delve into this. And some people are probably going, I'm still a little like, what do you mean plant compounds? Like, what are we talking about here? So let's
Right.
lay a foundation of what are we really talking about when we say, plant compounds, phytonutrients, what are these things?
Yeah, so when we look at a plant, and if we were to put a microscope on it and pull it apart, we have different components of a plant. You have macronutrients, which we all know, that's fats, proteins, carbohydrates. You have micronutrients, which are the vitamins and minerals. Those reside in plants as well, and they're hugely beneficial. And then you have phytonutrients. And phytonutrients is a broad class of basically organic compounds. And when we say organic compounds, we're not talking about organically grown produce or whatnot. We're talking about molecules that primarily have carbon in them. And so a lot of us have probably heard of, drinking a glass of red wine a day could be good for you because of a natural compound called resveratrol. Or we've probably heard of curcumin in turmeric. Those are examples of bioactive compounds of phytonutrients. And so those are the major components of plants. And it's the phytonutrients that really is a whole class of underutilized. It's an underutilized area of science. Like you said, there's not too many people that specialize specifically in this area.
And it's interesting to me because when we look at what is, the more predominant approach in this country, at least, which is, pharmacology, which is pharmaceutical drugs, really the origins of many of the compounds, many of the things that are manufactured now and used in these drugs, the origins of that are in plants, correct?
Exactly. Yeah. 50% of all pharmaceutical drugs are from plants. If I'm a pharma chemist, and I was one for a little bit, if you're a medicinal chemist, you get a structure that comes across your board is saying, hey, we want you to make a drug, and this is the starting scaffold that we want you to use. And that starting scaffold is actually a molecule from a plant. When pharma wants to find a lead to develop a new drug, they take all of these molecules from nature, screen them through a huge library to find something that fits, that's the closest fit to what they want to do. And then that's their starting point.
I think that's so important for people to understand because I find that many people in the general population just dismiss the power of plants and that's just whatever. Oh, that's holistic, natural, whatever. And I think it's very compelling for people to hear that, no, there's tremendous power in these to the point where 50% of the drugs that you believe in and you take actually are based on compounds in plants. I think that's a really important frame to put around this for people to understand.
That's right. It's not something, and it's nice that the paradigm's shifting a little bit. I see the last 5-10 years, we're moving in the right direction rapidly. I would say that's good. So plant medicine is no longer seen as that crazy thing that only hippies do, or your crazy aunt that visits once a year does, right? But that there are, and there's a lot of good science that's actually coming online too. The scientific literature is exploding on people who are studying compounds in plants and actually showing their benefit. They're running clinical grade studies. They're running, pharmaceutical grade studies, clinical studies on compounds in plants, just like they're doing with pharma drugs, and showing efficacy.
And that's so important. And I think a big piece of that is, especially in the realm that I operate in of mental health, psychiatry, psychology, so many of the medications that have been produced and used now for decades have really underperformed. We still have massive problems within the general population of people still being partially or fully symptomatic, even on these drugs. We've got the side effect issues. And so I think it has driven interest both among, consumers as well as companies, as well as professionals, of looking at, are there, other approaches that we can use here, plants being one of them.
Right. And I think human nature it's black or white, right?
Yeah,
it's either this or that. And what we're starting to realize is that pharmaceuticals are great. They're fantastic. They do a great job. These are small molecules that have been specifically designed to hit an active site, an enzyme in the body, and they bind with really, really tight affinity, nanomolar affinity. So they're not coming off. A lot of times they're suicide inhibitors. And so they do a great job, especially in reactive type wellness situations where our health is just kind of spiraling and it's going down, and you need something really strong to pull you out of that nosedive. But oftentimes we don't need really harsh reactive measures, proactive type measures. And that's where compounds from plants are great, because compounds from plants have evolved with humans over millions of years. And so when we take compounds from plants, they bind to targets in the body, but they don't bind as tightly as pharmaceutically designed drugs do. So they can kind of pop on and off. And that's actually good, because they can help modulate health in a more mild but effective way. And really, that's all the body needs a lot of times, just a gentle nudge to get back on course, rather than this harsh, hammer, so to speak.
That's really a great way of describing it. So let's go through some of the common things that we see in kids and, in adults, but we'll focus specifically on kids and teens, and have you share some of the things from, the research and from your experience, that can be helpful. So I think,
Okay.
let's start with anxiety, because that is certainly the big one, especially right now after almost 2 years of this pandemic situation. Just huge portions of the population of kids and adults dealing with some degree of problematic anxiety in their life. So
Yep.
what are some of the things that we can be thinking about in terms of these bioactive compounds, from plants and anxiety issues?
Yeah. So one of my favorite is there's a micronutrient called selenium, and it's really important. It's super important for mood disorders. When we look at mood disorders, a lot of times selenium is something that we're deficient in. A lot of people are deficient in selenium, and the Brazil nut is a rich source of selenium. It actually has selenium molecule. So it's not just selenium, the mineral itself, but it's attached to an organic compound. And so because of that, it's absorbed really quickly into the body. And so eating just one or two Brazil nuts a day, one Brazil nut on average, it depends, but it contains 70 to 90 micrograms of selenium. So if you take one or two of those a day, you're getting a huge dose of selenium. So that's a really nice way to get good amounts of selenium that can help with mood.
That's awesome. How about things like, there's a lot of talk now, and I've seen some papers about some of the like adaptogenic herbs and things for
Yeah.
anxiety in particular. What are some of the specific ones?
Yeah, when we look at adaptogens for anxiety, the best literature, hands down, is on ashwagandha. And a lot of us have probably heard of ashwagandha. It's from Ayurvedic medicine. It's now gotten mainstream. It's in a lot of different nutritional supplements. You could buy it as a powder just by itself. You could buy it in capsules. But ashwagandha has bioactive compounds in it, phytonutrients called withantholides. And these withantholides are really good at effectively reducing anxiety, particularly anxiety related to stress.
Yeah.
So if it's stress-induced anxiety, ashwagandha is very, very good at helping with that.
Mhm. One of the things that, a lot of kids who have moderate to high anxiety really struggle with is, um, that can manifest as sort of hyperactivity or just like overexcitement and elevation, which is different than how it can show up in adults, but we get that. And also, the other thing that I see often hand in hand with the high anxiety in kids is sleep issues. And I
Yes.
know that there are several compounds, several, things, that can be helpful. I'm thinking about, passion flower, valerian, lemon balm, some of those things that can be helpful for sort of that calming as we get towards sleep time. Are
Yep.
there certain ones that you think are more research supported or good to be thinking about for that sort of anxious, can't shut the mind off to settle down for sleep kind of situation?
Yeah, the one that comes to my mind is actually two natural compounds called magnolol and hinokiol from magnolia bark.
Ah,
Magnolia is really, really good with stress and anxiety, and it's also really good with sleep. And
mhm.
the active compounds in magnolia bark that help with sleep and anxiety are magnolol and hinokiol. And so these are, and again, you can buy magnolia bark powder standardized to these two bioactive compounds, and it's really effective.
Hmm. That leads me to a question that maybe would be good for us to answer or talk about before we go any further. What should people be looking for with these things? I mean, there's a broad range with this stuff, right?
Yeah.
Everything from like we've got a local place here in town that people will just show up in my office with like these baggies of things, all the way to like pharmaceutical grade standardized, supplements with this. What do you suggest that people be looking at from a consumer standpoint when they're thinking about purchasing or using some of these kinds of compounds?
Yeah, this is a big deal, and that's a great question, because obviously, when we put something into our body, the amount of trust, inherent trust there is huge. It's a lot different than laying on a mattress or using a pencil or whatnot, and so we need to be super vigilant. And I'm surprised at how people will just off a whim just go grab something and throw it in their mouth when they don't know where it's been. And so, really, you want to choose a company that has clinical studies on it, that has patents on it, that has transparency where you can actually see the lot that the supplement was produced, the micronutrients and the macronutrients, and to make sure it's not going to get you sick, just standard stuff like that. You really need to demand to see those sorts of things.
And I think especially where children are concerned, something that's got good standardized dosing on it. I mean, if you're just doing whatever, or, have a bag of something, it's like, you have to be really careful with children with all supplement kinds of things, not just the specific like herbs and plant compounds. Kids are not just miniature adults. And so we want to make sure that we're being appropriately cautious and that we know what we're giving them and how much of these active ingredients is in it. And, I agree. I'm always surprised. I think that's just like this bias that a lot of the general population has is, oh, it's natural, so it's fine. And it's like, no, these are actually powerful things.
Yeah. And like you said, standardization is key. We need to demand standardization. So a lot of times we think ginkgo is ginkgo. Well, no, you have ginkgo that's standardized to bioactive compounds called ginkgolides. And then you have ginkgo that's not standardized at all. So we have no idea what's in there. It's just a nice green looking powder. And so we need to make sure whenever we take any compound from a plant, it needs to be standardized. So we know, kind of like pharma, right? When you take a pharma drug, you're getting 10 mgs of Risperdal or whatever. We need to know that when I take this supplement that's hopefully been clinically studied, I'm getting 10 milligrams of ginkgolide B, I'm getting 20 milligrams of hinokiol, and so forth, so that you can actually quantify and run clinical studies and know that it's going to do its job reproducibly. That's the other problem, is a lot of times people buy something that works, ginkgo or whatever, and they'll run out of that bottle and they'll go and grab something else, and it doesn't work anymore, right? Because it's just totally different stuff.
I've seen that happen to families a lot, even with, basic micronutrient kinds of things. The formula, the type, all of that really matters, especially when we're talking about kids and their little bodies. And I think this is a bit of a tangent, but I think it's important to mention here. Nowhere is this a bigger issue right now than when we think about the whole realm of hemp, cannabis, CBD, all of that. As you were talking, that came to mind because I just am having conversation after conversation over the last couple of years with parents and, adult patients around that, and that whole issue of what is actually in this thing that you're taking, what is the standardization. I mean, I don't know if that's a concern you have, but it's something that I'm seeing just is really problematic right now.
Yeah, huge. The CBD, THC, cannabinoid industry in general is skyrocketing, and there's some nice literature coming out on CBD. It needs to be controlled. When we say CBD or cannabinoids, there's 50 different cannabinoids in the plant, and more yet to be discovered. There's more cannabinoids being discovered all the time because there's different strains that are being made of the cannabis plant, and those strains are producing different cannabinoids. And so while there is some pretty good anecdotal data on CBD, it hasn't been rigorously tested, especially in children at all. There really aren't any studies. And so it's questionable. I would stay away from that. I mean, potentially someone, has come to me and say, well, I gave CBD to my child and it really helped. And that's great. And I believe them. But when it comes to hardcore scientists, we don't speak until we see the data, and the data is just not there.
Yeah, I think the one area where we're seeing more of it come out, in particular to the pediatric population, is when we talk about epilepsy and specific forms of epilepsy. And certainly there are, some guidelines for use there. I think the concern is, again, what is it that you're taking? That whole industry is like the wild, wild west right now. And I think to your point about running out of one bottle and it's like, what is even in this stuff? How much? Like I get concerned about that, particularly for kids when we're talking about sort of that whole hemp CBD arena. It's like, you need to really know what's in the product and how much you're giving. That's just super important.
Yeah, and that's the problem. And I think that's why the FDA is being cautious because, they want CBD to have approval. It's kind of a catch-22 because CBD is already approved, like you said, as a pharmaceutical drug. Epidiolex is 100% CBD, and it's amazing in its ability for intractable seizures in Dravet syndrome and different types of seizures. But just saying CBD or cannabinoids, now you have Delta 8 cannabinoids that people are producing and whatnot. So it's basically kind of the Wild West. You have street drug type cannabinoids where people are taking CBD and THC as starting materials and they're doing chemistry on it to make different things. And we have to be careful.
Yeah, and I think it's something important that we talk about and educate our, teens and young adults about too, because it's stuff that they're going to be exposed to, especially now when we, talk about cannabis and the fact that marijuana is being legalized now across so many of the states. Like this is a reality of our kids' lives, and helping them to have some education and a healthy respect for what the plants are, what these can possibly do, problems that you could encounter, the safety pieces. Like these are conversations as parents that maybe it wouldn't have entered our mind 20 years ago, that these were, necessary conversations to have. But today it's really important.
Yeah, especially in the cannabis realm, where back in the day, you just had THC predominant variants, and THC, it's psychoactive, whatnot, but it's not going to really harm you. It's blunting and whatnot. Some of these cannabinoids that are synthetically being developed are just crazy active in crazy small amounts. And so it's dangerous. And when you talked about that made me think, a lot of people think, well, plant-based stuff is great and it's amazing. And it is, and it's safe. And a lot of it is, but it can also be dangerous if you don't know what you're doing, right? There's plants that can help you, but there's plants that can kill you deader than a doornail,
right.
in a nanosecond if you're not careful. So we need to really understand what we're doing and what we're putting into our bodies.
That makes me think also the precautions around the mixing of plant compounds and certain natural substances with pharmaceuticals that you or your child might be taking, that it's important to, be talking with your healthcare provider about that, to make sure that things in combination, like there are certain things that sometimes are recommended, in the realm of mental health, let's say for anxiety or something like that, that really are contraindicated if you're currently on an SSRI drug or something like that. And so just, being open and honest with everyone on your care team about what it is that you're taking, natural or not, is really the safe route, especially when we're talking about kids.
Right. Yeah, no, that's exactly right. Especially with supplements too. A lot of people, when you make a supplement, you can throw anything into the supplement theoretically that's generally recognized as safe by the FDA. But that generally recognized as safe does not include synergistic interactions, right? And so we talk about synergy, and everybody thinks, well, 1 + 1 is 3. That's great, but you can also have negative synergy. 1 + 1 can equal -1,000, right? So a lot of times you can have a supplement where people don't clinically test the final product, where they're just like, oh, more is better. This is cool, this is cool, this is cool. And they throw it in, and they can actually have contraindications and deleterious side effects in that supplement because people aren't thinking smartly. You have bioactive compounds that are working on different biosynthetic machineries and pathways in the body, and it can cause harm if you don't know what you're doing, if you're just throwing things in.
Yeah, it's a great point. Let's get back to sort of our condition-specific things. We talked a bit about some anxiety. How about ADHD? Because there's some interesting data on specific bioactive, compounds around. I mean, what we call ADHD, I contend, is probably actually dozens of different presentations of, symptoms. But in general, when we think about ADHD presentations, we're talking about, problems with focus and concentration, the impulsivity, the hyperactivity. So what are some of the things to be thinking about with plants and those kinds of symptoms?
Yeah, so not quite a plant, but I would lump it in that realm with bioactive compounds as omega-3 fatty acids. where we have a DHA specifically. If you look at the literature, 300 milligrams of DHA seems to be a really good dose that can help with a lot of symptoms with ADHD. EPA and DHA, your listeners have heard those before, probably. Those are omega-3 fatty acids. One thing that's really interesting is EPA and DHA are actually prodrugs. So they're not the active compounds. They're actually converted in the body into a class of compounds called specialized pro-resolving mediators, or SPMs, like resolvins, protectins, and mucins. And these actually help to resolve inflammation. And so inflammation, as you know, is the root cause of all disease. If you ask a medical doctor, inflammation, you want to reduce inflammation, and inflammation is present in a lot of these mental health states. The brain is an organ, it gets inflamed. And so omega-3 and these specialized pro-resolving mediators that come from DHA are really good at supporting inflammation, specifically related to brain health and ADHD.
I want to ask about, and this kind of ties in with the anxiety piece too, because I've seen literature on both. Saffron.
Yes.
Is an interesting option now. I believe, I might be wrong about this, but I think I read an article fairly recently that there's some drug manufacturers looking at how to make proprietary types of saffron to include in their formulas. Can you talk a bit about that? Because I think some of the data on that so far is pretty compelling.
Yeah, saffron does have really good data. It's a bit stronger in anxiety than it is ADHD. I would say the anxiety data is very, very strong. The ADHD data is quite strong, but there's more that needs to be done there, but it's still really, really good. There's a bioactive compound in saffron called saffronal. And saffronal is the compound that a lot of people, again, pharma drugs are taking it as a starting point and trying to do their magic, that, to make different derivatives to see if they could find something that's more active that fits their need states. But saffron is really good. Using saffron in cooking, if you can, I know it's expensive, is really, really good thing to do. Taking a teaspoon of saffron and steeping it as a tea, a teaspoon of saffron threads in 8 ounces of water and steeping it for 5 minutes or so is really good. Side note, saffron is also really good with PMS and actually PMDD. It's very effective for that. So a lot of good bioactive compounds in saffron.
That's great. I didn't know that about PMDD. That's great, because I see, a handful of cases of severe, PMDD in younger girls and young adult women. So that's great to know. What else was sort of the focus piece of things? Like sometimes we hear about things like maybe rhodiola, like some of these other kinds of herbs and plants that maybe have some efficacy for that, or in some of like the focus formulas that parents often ask about. Data for any of those? Are there other ones that you think make sense to consider, or that are often included in formulas for these kinds of issues?
Yeah, some of the ones that have the best research on them, we talked about omega-3. The next one is phosphatidylserine. Phosphatidylserine has some really good data on it, about 200 milligrams of phosphatidylserine. They did a clinical study, several clinical studies, and the average time, 200 milligrams a day, and they looked at ADHD symptoms over the course of 2 months, and they found that there was a marked reduction in ADHD tendencies and behaviors and symptoms when on phosphatidylserine. So that's a really good one. The other one that has good data is carnitine. L-carnitine, 500 to about 1,000 mgs is the standard. About 750 mgs in children ages 7 to 12. Obviously, talk with your doctor, but that's usually what they recommend. And they found that supplementation with carnitine really helps with symptoms of ADHD, reduce aggression. Where delinquency is a problem, they saw significant reductions in delinquency rates and improved attention.
Yeah, and I think it's worth noting, going back to what you had said about the omega-3 fatty acids, often parents will come in and say, oh, I tried that. And when we talk about what they use, they weren't anywhere close to a therapeutic dose of what the studies show is actually supportive of symptom reduction. So I think that's just important to mention, because parents will be like, oh, I got this bottle of fish oil or these capsules, and I was just giving the dose on the label. And actually in the studies, what we see is that these kids and adults benefit from much higher dosing.
Right, exactly. And a lot of times in the case, so when we talk about omega-3, it's specifically DHA,
Yes.
right? And a lot of times people will be using just run-of-the-mill
Mhm.
fish oil that's not standardized at all to either EPA or DHA. And so, it's no wonder it's not working.
Mhm.
But yeah, you have to look at the standardization there. And like you said, a lot of times you might have to up the dose depending on the form and the standardization in the bottle.
Yeah, and I think that's just important to recognize with all of these things. If you're thinking, well, I tried that, just to consider, was it the right form? Was it a therapeutic dose? Like all of those factors really make a difference.
Yeah, that's right. That's right. It's not just a blanket saying I tried that, but it really has to be just scientifically, like again, like a pharma drug, right? I mean, it has to be dialed in. It has to be specific, has to be standardized. It has to be at the right dose. And when you do that, the literature is pretty good.
Yeah. Let's talk about autism spectrum disorder specifically.
Yeah.
And some research that's coming out about that, some things that you think should be on our radar as far as if a child is having, symptoms of autism or has been diagnosed as autistic. Is there some evidence for this? What are there specific compounds we should be thinking about?
Yeah, when you look at the scientific literature, the natural compounds that I think are the strongest are, again, L-carnitine is really good. 50 mgs per kilogram of body weight is kind of one of the standard dosage there. And then N-acetylcysteine is also really good by itself, but it also is really good as an adjuvant. There's been some studies coming out showing that N-acetylcysteine as an adjuvant there was one with risperidone that it significantly reduced irritability and and a few other parameters related to autism. So those are the two that I've seen that are the strongest. Other ones that are out there, ginkgo biloba. Um, I don't think the literature on ginkgo is that strong for autism. Ginkgo is obviously an amazing adaptogen. It's a nootropic. It helps with cognitive function and a lot of other things. But when it comes to autism, I'm not really seeing it. CoQ10, there's some data there. I would say that the data is okay. There's some more studies that need to be done, but that's kind of where I see things are at right now.
Yeah, and I think the challenge with something like autism is that it's such a broad spectrum. And again,
Right.
my clinical opinion is that what we call autism spectrum disorder is probably hundreds of very specific presentations of genetic and environmental combinations, which makes it difficult to study, right? Because you could say, well, we studied this compound or this medication or this type of therapy on 100 12-year-olds diagnosed with autism. Well, that really doesn't tell us anything about how similar, they are to one another. And so I think that's a challenge. And what I find often with kids, diagnosed on the spectrum is you have to look at their specific symptom presentations. And for example, if you have a kid who's obviously highly anxious, you might look to some of the compounds or some of the things that we use in anxiety to help support that, as opposed to just looking at like, what do we have that's effective for the autism? I think a lot of times we're looking at what's effective at supporting reduction of some of these co-occurring kinds of symptoms.
Right. Yeah. No, exactly.
Sleep being a huge one. I know that there have been a couple of good studies on more developmental disabilities, more broadly in kids, but looking at combinations of like valerian and lemon balm. But sleep is such a problem in the population of kids with neurodevelopmental issues. What do you think about sleep with kids? Whether they have a diagnosed disorder or not, are there certain things just more broadly for sleep issues?
Yeah. So when it comes to sleep, I do like magnolia bark. That's
Yeah,
one that,
right.
again, standardized to magnolol and hinokiol. That's quite good. That has good data behind it. Lemon balm is not bad. Valerian root. The literature on valerian root. It looks strong when you look at it, but then when you kind of dig into the studies, I'm not so hot on valerian. It seems like there's some what's the word I'm looking for?
Like your mileage may vary.
Yeah, mileage may vary. That there's vested interest from maybe other groups that
Oh,
have
yeah, sure.
yeah.
Yeah.
So there, it looks like there's some of that going on, but valerian's not bad, but magnolia bark is quite good.
Yeah, you had mentioned the magnolia bark, and I wondered if that was specific to more of the anxiety or more broadly, but you're saying just for kids with sleep issues in general, the magnolia bark is a good one to look to.
It is. Yep. It's good for both.
That's great. That's great. I want to ask about one more sort of realm before we wrap up, and that is like kids, people who don't have a specific mental health, diagnosis, but maybe just are struggling with regulating emotions and behaviors. And this could be adults or kids. And I think this is particularly relevant in this, I'd love to say post-pandemic, but I'm just going to say like pandemic stage that we're living
Right.
through. Like people are struggling with, managing their emotions, their behaviors. Are there, some links to organic compounds, either things that maybe people are exposed to that are making that more problematic, or things that we could use that can support us in that way?
Yeah. So, in studying compounds in plants, one of the common threads that I'm seeing is, just kind of a brief primer on how the body works, right? The body performs millions of chemical reactions every single second. And these reactions are involved from, everything from heart health to brain health, respiration, breathing, all the way to maintaining healthy mood, right? Keeping anxiety at bay. And these reactions are controlled by enzymes, right? If we take a step back, enzymes are these machines that make it happen. If you step back from enzymes, genes control enzymes. We've heard of genes, DNA and genes in our body. These are like switches that turn on and off. And then if you step back from there, you have what are called signal transduction cascades or biosignaling mechanisms. And when we look at the root cause of what molecules in plants do, most of them are regulators of these biosignaling reactions. So they're at the very, very beginning that actually help to catalyze and make sure all the reactions in the body are functioning properly. And so natural compounds like ginkgolides and ginkgo and rosavins from rhodiola and berberine are actually really good at regulating biosignaling mechanisms in the body that can help with mood, that can help with cognitive performance, with productivity, with mindset, positive mindset, and a lot of different things that are just really helpful, like you said, for all of us, just part of, trying to be a good human being and get through the day.
Right. Absolutely. So interesting to have you explain, just the physiological processes behind that, because we don't think about that, right? We don't think about all those steps and components we take for granted when things are operating well in our brain and our body, and we don't really think about all the intricate steps of how that happens. And I just think it's so good sometimes to, take a step back and look at all those pieces look at all the things that have to work together and work properly to allow us, to function well.
Right. And these phytonutrients are critical for human health. These are the medicinal components of plants. And with the modern processed diet, no shocker, you can go an entire day without taking a single phytonutrient. And it's not that hard, right? You think about foods that we're prone to give our children and that we eat ourselves, right? The modern processed diet, there's no phytonutrients in any of that really, right? It's a miracle of food engineering that we're able to make food, but good health is so much more than macros. It's just funny to see people counting macros and paying so much attention to that, but they're not paying attention to phytonutrients that actually regulate the genes in the body. It doesn't matter if your macros are right. If your genes aren't working, then, it's a losing battle.
So true. And so I think as we wrap up on a broad level, we've talked about specific compounds, supplements and things to look at, but really at a foundational level, one of the most important things we can all be doing for ourselves and our kids is working on getting more plants into our bodies in the form of the food that we're eating every day, right?
That's right. I mean, it's that simple, really. Plants have been with us since the beginning of time. They're here to help us, and eating plants, these phytonutrients, are just vital for health. And so we need to make sure that we take the time and the effort, and it can be, laborious sometimes to get phytonutrients into the mouths of our kids and, for us to take them, but it's vital for health.
Yeah, absolutely. Such an important point, and really appreciate all the information that you shared. I want to make sure that listeners know where they can find out more about you and your work.
Yeah, so I have a podcast, and had you as a guest on my podcast. Look forward to that episode airing. So it's Discover with Dr. Dan, Proactive Health. So your listeners can go there and check that out. I'm on Instagram, Dr. Dan Gubler, DANGUBLER. I'm also on TikTok, same handle, trying to do the young kid thing.
Wow, look at
See how
you
that
doing
goes.
TikTok.
I know.
Nice.
We're giving that a go. And then I do make some supplements. So if you want to look at different supplements, I have a company called Brilliant, and the website is Feel Brilliant, FEEL Brilliant.com. And I also have a women's wellness brand called Clea. And the URL for that is HelloClea, CLEA.com.
Wonderful. Amazing. I know people are going to want to go check all those out. Thank you for being with us today. Thank you for sharing all of your wisdom around this. Such a fascinating topic, and really appreciate your time.
Thanks, Dr. Nicole, for having me. It was marvelous.
And thanks to all of you, as always, for listening. We'll catch you back here next time.